We're so excited you're here. As my panelists make their way up, I'm Jane Ellery, and I coordinate the Lifespan Wellness Learning Experiences at Ball State, and I study the impact that place has on health and well-being. And I'm also the president of Sustainable Muncie, the board, because the work that I've done suggests that helping people transition from being consumers in our society of services, of products, to being builders and makers is one way to help enhance health and well-being. And that comes from a lot of work that started in workplace wellness. And we were so excited when we started having these conversations to say what this should look like for Delaware County today. It's like, what makes Delaware County unique? And one of the things that we're leading the charge statewide on how employer groups are involved in the health and well-being of our employees. So that's what we decided this unique panel could look like. And I would like to take each of the panelists to take a minute to introduce themselves and talk briefly about the work they're doing. In your bag, and I was instructed to hold up so you all remember what your bag looks like, there is a pad of paper and a pen. So I'd like you to take that out now, so everyone will give you a minute to wrestle around. And if you have questions, I have lots of questions that I can ask, but I know them and I know what their answers are gonna be, and that's good, and it's important for you to hear those. But also we want you to have questions, so there'll be people throughout the room picking up your questions. And we've got quite a bit of time here, so you can ask lots of questions. Yeah, just hold them up and they'll come around and grab them. Why don't we start with Bryan on the far end, and you can take a minute to introduce yourself and just talk a little bit about what Open Door is doing.
So my name is Bryan Ayars. I'm the CEO of Open Door Health Services. We're a federally qualified health center based here in Muncie, but serving the population throughout the region. Last year, we served about 30,000 individuals, most of them at 200% of the federal poverty level or less. We've heard about the need to stay out of the silos, and I think that's one of the things we concentrate on a lot. We have your basic health services, primary care, dental, behavioral health, WIC, family planning, lots of social support services as well. One of the areas we're focusing on more is, while we provide medical care and dental care, that's just a piece of the puzzle. If an individual doesn't have access to a safe home, a safe living environment, food, the work we do is not necessarily for naught, but it's not very effective. So we found, and the employees get this, we need to be working with organizations and individuals throughout the community to make the lives of our patients better. If we can make the lives of our patients better, we can improve the health of the communities where we all live and work. So our emphasis is not away from healthcare, but it is in incorporating healthcare into all aspects of an individual's life and well-being. They need food. They need nutritious food. They need a roof over their head. They need to be able to afford the medications that they're taking. They need access to other support services. We can't do that all. There are organizations in the room who can help us do that, and we can help them do what they're doing. There's no issue in the community that we can do alone or that any one organization can do alone. We all have to be working together, and this is a good step in that direction.
I'm Nathan Taylor. I'm in charge of, or responsible for helping us oversee our employee well-being efforts at the Youth Opportunity Center, where we have about 500 employees that are doing the hard work day in and day out of caring for youth that have been placed in our care through the juvenile court system. And so I try to think outside the box and think broadly about well-being and what that means. And I'll probably touch on that a little bit more later, but try to take an approach with that is looking at the whole person and looking at the whole organization and merging the two in terms of our goals as individuals and our goals as a workplace so that we can all thrive and reach our full potential. And then I also facilitate the Delaware County Wellness Professionals Group. We started back in 2011 and with a couple objectives in mind. One was selfish, was really my own personal interest in networking and growing as a wellness professional. So I wanted to get people together that were doing what I was doing in our community in workplaces so that we could all grow and share and get better at doing what we're doing. But some of the other objectives have to do with helping our workplaces be recognized as well workplaces in partnership with the Wellness Council of Indiana, and there's a couple of representatives here from the Wellness Council of Indiana. And the purpose for that being to help our community at large be recognized as a healthy community through the same organization, through the Wellness Council of Indiana. And what the Wellness Council recognized at that time was workplaces, businesses are the driving force for community health and well-being. And so the Delaware County Wellness Professionals Group, we get together once a month and talk shop about what we're doing in our respective workplaces around improving the health and well-being of our workforce to the end that it impacts, obviously, our community at large. And so that's another big task and responsibility that I'm a part of. So.
Thank you. My name is Rhonda Wilson, and I am the director of our employee wellness program here at Ball State University. So that covers 3,000 people that we employ, and I do work closely with my colleagues who also cover about 20,000 students that make up a large part of our community. So we do some collaborations together, but our main focus here at Ball State is really looking, much like Nathan said, the employee as a whole. And that includes everything from financial, emotional, social, physical well-being. And I'm an office of 3. So, and much like Nathan and most any corporate wellness programs, even with a director and a small staff, that's a lot of responsibility to try to change the lives of all those employees. So one of our most important factors is collaboration, and you've heard that today, silos, really working to get out of those silos. I have these employees for 40 hours a week, maybe 20, some of them, and maybe some of them more like 60, but it doesn't matter. Once they leave the workplace, they then turn to the community. And so what are we doing in the community to really collaborate and draw those bridges, because they can't be one person at work and one person at home. And so bringing that lifestyle together and creating programming that will allow them to be the most productive, effective employee at work, but also the most productive family person and community person that they can be is our goal with our program.
Hello, I'm Steve Smith, CEO of Midwest Metal Products. We're a wire sheet metal fabricating company here in Muncie. We don't make the sheet metal, we don't make the wire, but we buy that, we form it, we weld it. Our biggest product line is pet homes. You would probably refer to as pet crates, pet cages even, but that's too harsh. I mean, they're pet homes. 25 years ago, what we did, our whole marketing strategy was to educate the people. We had to educate them that the dog has a denning instinct. The dog, I mean, they housebreak a lot quicker. My dog, for instance, if it's thundering outside, is completely nervous. He goes into his pet home. He can see through it. He still hears the noises, but he just calms right down. So there is a denning instinct to them, and it's a security. Even though they can see out, there's ventilation, it is that security. Well, we had to change, because for every year there's about 12 million puppies born. Well, at that time we had about 12% of the market use crate training. Okay, now we're up to about 15%. So each 1% we increase is good news for us, because that's 120,000 more pet homes that we're able to go out on the market. We approach sort of the same way with our employees. The metrics, our employees probably hit those metrics pretty much right on. So as Hank said, a lot of it's behavioral. I mean, we can control our own health, and that's what we do. We give them incentive. We pull them off the line or out of the workforce, off the floor for about 20 minutes, put them through a blood profile, go through, blood pressure, all this. But the whole key, as a matter of fact, we even pay them $10 if they will do this, just to sit down, and it's an education is what we're trying to get through to them, that they control their own destiny. You know, would they get a BMI so they know their body mass is off, and they can change their diets, they can change their exercise program, and that's what we're trying to get across to them, and that's how we're approaching it with them. And the same one, we haven't done it yet, but it's the same thing. Okay, we make, the employees have to pay, it's about 35% of their own health premium they're paying for. We're self-insured, so the better off we do, you know, it falls right to our bottom line. The industry we're in, we're the best in the United States, but we're in a global economy. So our competition's coming from Southeast Asia. So that's our metrics, that's what we're benchmarking, so what's going on over there, even though we want to provide the best care for them here. So what our tactics have been, and it's been this way for about the last 5 years, is just change your behavior and the benefits that go with that.
Thank you all very much. I'd like to start the questioning with you, Nathan, and to build on this idea of a healthy community and what that looks like and what the employers can bring. One of the things that Delaware County was recognized as the first Indiana healthy community by the Wellness Council of Indiana and the State Chamber of Commerce. And you can believe when I called the paper and said, look, we got this designation, they said, we are not healthy. And I said, I know, but we have a lot of amazing people who are working to create an environment where health can occur. And one of those is this group that the Delaware County Wellness Professionals are looking at. Individual health isn't something that employers typically take into account on an everyday basis. What role do you see the employer playing in improving the well-being of the people who live in our community?
Yeah, I think I'm going to borrow from Maslow a little bit and use a pyramid image. One of the things that we hear a lot in workplace wellness is, you know, there's programming this, there's programming that, there's incentives this, incentives that. And what I want to talk about, I guess, briefly is if you look at the pyramid, and I'm going to borrow a little bit also from a group that I tap into, Salveo Partners, they're leaders in our field of workplace wellness and organizational development. The top of the pyramid, the way I see it is where workplace wellness fits. And if you know Maslow's pyramid, that's where self-actualization sits, right? Everything else under that pyramid has to be met before self-actualization can happen. And so I'm going to throw out another buzzword, culture. We've heard about that. We always talk about that in workplace wellness. And you know, there's so many buzzwords that come and go and they become garbage terms after a while. But the way I see it with this pyramid and this idea of how we do workplace wellness isn't just running a program or running an incentive and say, yeah, we have a wellness program. Yeah, that may be a great start and it may be something that we can do right off the bat. But everything under the base or at the base of that pyramid, holding up the top of that pyramid, contributes to the well-being of our people. And it comes down to seeing people as people, treating them as human beings. It comes down to developing them and their leadership skills and desires, giving them an environment that supports them in how they communicate with one another, and having a supervisor that values them, allowing them to work in their skill sets. And so workplace wellness is so much more, or requires so much more than just having a wellness person on site who's knowledgeable of health metrics or disease or needs in that vein. It's how does leadership and how do we develop our people so that we can meet all their needs. Just like Maslow's pyramid, you've got to have security and you've got to have love and kindness and feel like you have a sense of belonging. All of those other needs have to be met in the workplace when we talk about getting people to be healthier, right? Behavior change is extremely hard, and it doesn't just happen because we know that, oh, I should be healthier, so I'm going to go do it. We need a supportive culture and environment, and those hierarchy of needs plays out in how we do workplace wellness as well. So it can't happen in isolation, in silos, as we keep talking about. and it has to be a broader approach that has strong foundations to it. So, did I answer your question?
Yes, anyone else would like to add?
You know, Nathan touched on behavior change, and I think two key components that go into behavior change are policy change and environment change. So I'll just give you a little background. When we first looked at tobacco cessation on campus, we did a great thing, and we created these tobacco areas, right? Because we're going to get rid of it across campus, and we're going to just put it in little areas. That was great until we found out that our freshmen almost increased smoking because they wanted to be social, and these areas were by the dorms. What a great idea. So, you know, going back, looking at policy change and behavior change and environment change. So removing the environment, removing those tobacco areas and taking them off campus. It wasn't like we were trying to be a big brother. We're just trying to change the environment. So there's a lot of things that you can do to look at changing environment along with policy change, which go hand in hand, and then with behavior change. So think of it as that three-legged stool and not just a slap down of policy on something. You know, what else goes into play with it? And I think looking at that triad make a big difference in impacting the health of your employees.
And we're really lucky. There are our Purdue Extension folks, our mayor, we've got Bike Ped, we've got so many things going on in our community that really focus on that. And Bryan, I'm going to jump to you to change the question a little bit, because you've got the responsibility both for your own employees and for creating kind of a community-wide culture around health and well-being. Could you talk a little bit about the challenges and the excitements you see in doing that, please?
The challenges. Internally with our employees, and Nate talked about culture. I've been there for almost 2 years. The culture of the organization from the employees, they're driving the cultural change towards wellness. We have employee committees, wellness committees, employee engagement. They're looking for opportunities that are meaningful to them that will improve their wellness. And it's not just physical wellness, nutritional, mental, it's the whole picture. We've invested more in our employee health in the last 2 years, and we've seen a greater reduction in our employee health costs. That's not bad. And we hope to continue that push forward. Healthcare costs are going to continue to go up. As employers, we need to figure out a way to change that in an affordable way for our employees and our organization. From the patient perspective, it's much more difficult. We've got 170 employees. They're dependent on the organization for things like income. So we have some leverage. The patients don't necessarily see that same leverage point. They have bigger challenges. Back to Maslow's hierarchy, they need to have their basic needs met before they can worry about, I'm going to be physically fit. So we continue to try to improve our message to employees and our message to the community and the opportunities that exist. And again, we can't provide all the opportunities, but man, there are a lot of opportunities in the community. The challenge is getting people connected to those opportunities and getting to realize the benefits of that. It's an ongoing process.
Anyone else have something to add?
Back to the policy thing too. I mean, we sat there to help the employees out. A lot of them don't have a primary care doctor. So we sat there and said, okay, our insurance, you get one visit, a physical a year, or whatever you want to call it, so that you can go, just so that you start to build a track record. Now, did it work? The healthy ones went. Sort of our ones that are in the unhealthy category, no, they still wouldn't go. So that's why you try different things to make, hopefully, different things work.
Well, and to build on that, you said, you know, we talked about the silos. What do you see healthcare organizations and other organizations throughout our community? How can they help you, Steve, with what you want for your employees?
Fortunately, I'm on the board of Meridian, so Hank puts us through retreat once a year in Indianapolis, but it's very educational. And I think the primary thing is to get them to a primary doctor, because it could be an emotional problem, it could be a mental problem. And as it came out, a lot of the primary care doctors don't know how to handle a mental issue. They'll probably prescribe it, but they'll probably underprescribe it. Well, you go to Meridian, you go to the primary care doctor, okay, something's obviously here, we got a mental issue. Okay, next time come in next week, we're gonna sit down with a psychiatrist, or we're gonna sit down with someone that's a specialist in that field. They prescribe it right, and then they get it, the person on a recovery course. Because mental people, if untreated, they're gonna be institutionalized, or you just look at the prisons, that's where they're gonna end up eventually if they're not untreated.
And do any of the rest of you, would you like to talk a little bit about how you need everyone in the community to be part of what is going on in your particular work plan?
Yeah, I guess just kind of building off of that a little bit and going back to the environment, the work environment and culture, and mental health comes up and things like that. If you think about a work environment that is stressful or hard, you have a boss, a supervisor that's hard to work for or work with. You kind of alluded to this too. If you're having stress in your own personal life or stress at work, mental health, mental stress, whatever that is, you have a hard time getting someone to engage in, choosing to eat a healthy meal or make dinner for the family when they get home. It's no, I gotta get McDonald's on the way home and I don't have time for that and I'm too stressed and I'm gonna find something that I can quickly get, And so, how do we address it as a community? I think obviously that's a big societal tide that we all are swimming in when we think about culture. We don't even realize some of those hurdles and barriers that we're dealing with because it's just normal life. But I think about care, access to care. We have a lot of care available to us in our community. The YOC, we have on-site health care through an on-site health center. We have, that's managed by IU Health Business Solutions, and we have an on-site health coach who's here today visiting with us. And so, having someone who can sit down with your folks, sit down with your employees one-on-one, and you do have health coaching available as well at Ball State, and that personal one-on-one time becomes really rich and valuable because that's where real conversations happen and the discussions around change and, oh wait, your life is how stressful? Oh, well, let's deal with that first and make sure that we make whatever behavior change the doctor would like to see manageable in a stepwise kind of progression. So those kinds of care points are important.
Thank you. Rhonda, I'd like to, you're dealing with a lot of people, and I'm, of course, a Ball State employee, so I know a lot of the initiatives that you've got going on. How do you encourage people to participate and to have buy-in to everything that you're offering?
That's a great question because I think participation is one of those things that is just, you have to find ways. It's developed through personal relationships. It's getting out. It's being out in front of people, kind of saying all the programs that we have, having a variety of programs. These programs are great, and sometimes we have to be patient. We have to have the programs in place, and when people are ready, they will use them. And we've caught things through biometric screenings. We've caught cancer. We've caught simple things, just high cholesterol, high blood pressure that, like Steve mentioned, they do these screenings, and you want participation in them. And so really incentivizing. We try not to incentivize too much. Jade and I and all of us have had several conversations of, are incentives a good thing? Are they a bad thing? And I think to get initial buy-in, they really do bring people in. Our biggest incentive that we have and that we've had for the past 6-8 years is our $900 tobacco premium discount. And we went from a tobacco smoking rate when we first started this in 2012 of around 83%, and we are now tobacco free, and now we are at 92% tobacco free. at Ball State University. So is that $900 incentive a big buy-in to get participation? It is. But we also know there's a lot of personal reasons that people are quitting using tobacco also.
So as you think, and I'm going to kind of put it out there and you guys can decide which ones to jump into, certainly workplace interventions and workplace wellness has changed over the last 30 years. We started, my undergrad and master's are clinical exercise physiology. We started with exercise programs and we've kind of shifted to where, we know that's one component of it, but it has to be a whole lot more. Can you talk a little bit about what progressions you've seen in your own companies or the work that you have done, and how that has impacted the approach that you take today?
Like Jane said, we think so much physical. We have a great rec center on campus, and we get to collaborate with that. But a lot of our programs have really changed from emotional, social. Social is a huge component. If they can bring a coworker, if they can bring a family member, we see a lot greater participation when we see those types of social engagement activities. I think one of the biggest trends we're seeing right now is financial well-being. We are having a lot of interest in a lot of our financial well-being programs. That's not something we offered 5 years ago. It wasn't something we really focused on. We were thinking, how do we get people to quit tobacco? How do we get people to exercise right? And so I think we're seeing a trend and a lot of focus more towards the financial and the emotional well-being.
We had a freight company every Friday would bring in donuts. Now he has to bring in a fruit tray.
So thinking about the food that's available,
Right.
The opportunities are a real key. We know that our zip code is probably a greater predictor of our morbidity and mortality than our genetic code, and so much of that is because of the opportunities. Nathan, were you
Yeah,
gonna-
I think financial well-being is more in our discussion these days. I think broadly there's been a shift in the discussion around incentives and just having those hard discussions and realizing that it's really, really hard to change behaviors with incentives, and so they're not necessarily as effective as they were once touted to be. And so using them well, and I think as Rhonda said, we've had a lot of discussions amongst ourselves in the industry about, well, how do you use them? When do you use them? How do they work? Do they not? What's the impact? What's the drawbacks? Those kinds of things. So that seems to be just an ongoing discussion, and I think reality check for the industry in general, and so we keep having that and keep checking in with that. I think for me, one of the biggest transitions for me is shifting over the last 10 years from the physical stuff, heavy emphasis on the physical well-being, to the broader, okay, how do we go about hiring people? What's our process as a culture, as an organization? How do we identify the right candidates? And there's a lot of stress that happens in our work environment. So what are we doing to talk about that and provide outlets for supervisors to be equipped and respond to that well? What are our approaches to leadership development and how we help people in our organization live and breathe and walk our values, and so that we are a quality environment where people can thrive and be their best selves. And so those kinds of shifts to a broader perspective have taken place for me. And I see that in other workplaces as well. I think about Muncie Power Products and what they've done in terms of people development and having a department specifically developed to that. So those are some of the shifts I guess I would touch on.
I agree. The physical component is still there, but there is a great interest in mindfulness, meditation, other things that help the physical components that employees want and are interested in or are curious about that can be very effective. The incentives, what's an incentive to somebody might be an insult to the next person. Competition is a great incentive as long as it's healthy competition. within our organization. There's some financial incentive. The inter-team competitiveness, I think, seems to drive more of it than anything else.
Very nice. And we're going to shift just a little bit here. As we think about disparities by race, they obviously still exist. And there's a lot of thinking that's going on right now about implicit bias and microaggression and the negative impact on health. Do you have any race relations or diversity thinking? What kind of programs are helping bring everyone to the table?
I know that's a hot topic right now, obviously. As an organization, we've historically always had diversity training for all of our employees, so it's something that we continue to do, obviously. I'm not directly involved with that in terms of, our culture from a well-being standpoint, but I'm definitely going to be thinking more about that. Just getting that question even now, what more are we doing or can we be doing as a workplace? Definitely think that we try to do a good job of that as a workplace, but like I said, I'm not directly involved in that work and how we do that training, but we'll continue to explore that.
We've all heard about being culturally sensitive. How you go about doing that, again, is probably unique to the organization and the community. Currently, I'm missing our diversity training at work, but it's a fair trade-off. We quarterly have staff meetings. We do staff education there. We do staff education in other areas as well on how to be sensitive to different cultural needs, biases, whatever it might be. I'd speak to the folks in the medical field on what training occurs. I think there's more and more training and sensitivity to being aware of cultural bias and how to address that. Not to throw Jeff in the...
Well, and also I would like to add, cultural sensitivity is a wonderful first step, but cultural inclusion really comes to the forefront when everyone is treated as an individual and allowed to understand who they are and how they work in the world. So we can keep working toward that. And I want to thank the individual who suggested that question for reminding us that we have a pretty white panel here today. So we'll have to think a little more about that as we go forward as well. So thank you. So we've talked about tobacco, and certainly reducing tobacco is huge in our next steps as a state and as a community. Are there other things, maybe around obesity, maybe around other options that are out there that are also not so healthy that we could also consider taxes on? In this particular case, we've talked about taxing supersizing meals, or maybe a higher tax on the plus fashion industry, or are there other taxes that we can think about imposing that may or may not be useful in our plans?
Without making a political statement, I don't think we can tax our way to better health. I think there are areas that we can increase the taxes and the revenues. We better have a plan for how we're going to do that and make sure we do that. The tax settlement that happened however many years ago with the tobacco companies, states have used that to line their own pockets and to pave roads and do all sorts of other things that are not really health related. I think if we're going to move forward in those areas, we better have a plan for what we're going to do with that and hold ourselves accountable. New York City tried to tax big cups of soda. That didn't work. Got to be careful.
Yeah. And I think from the proactive or a different approach to look at too, and this is broader and bigger than, in some sense, our local work, but if you think about the Farm Bill and how food is subsidized, how food is grown, harvested, manufactured, produced, marketed, sold, that the money is in that game in terms of money, food production. And so how do we get money in the hands of our local farmers and local food growers and producers and distributors, or just money in the hands of produce growers? You know, I don't know what that looks like, but there's an imbalance of cost of food, and our value proposition on food is horrible. You know, it's how many calories can I get in my grocery cart for $1, when it should be how much value, how much nutrition. And we just don't think that way. You know, food is one of the cheapest things in our budget, which is the cheapest piece of sort of our economy in the world. We spend less on food than any other place in the world. And I just don't understand why we think that food should be the cheapest thing to us, the stuff we actually put in our bodies. So I don't want to get on a soapbox, but you know, if you think about how food is given to us and brought to us, it's just out of balance, and there's a big skew on the value proposition for it. So tax it, make it more affordable, you know, maybe that's helpful. And make it more accessible and available. And I think we're doing a lot of that. You have Ball State working on a food hub. You've got the downtown farm stand. You've got the farmers market. You've got all kinds of places in town where people can get locally grown fresh produce. I know there's more work to do with that, and you know, but I think we need to think more creatively about some of those things as well.
In the manufacturing area, it's probably for the hourly worker, it's the drug is the main problem. It's drugs, because if you're obese or you have high blood pressure, you got diabetic, you're still functioning at work. But if you have a drug problem, they start missing Mondays, they start missing Fridays. They're not, you know, an hourly worker, that income's not coming back to the household, so it just sort of starts to escalate. And you can see it coming. Of course, to get employment, there's a couple of major employers here in town. I mean, one needs 80 people, another one needs 65, another one needs 60 people. Fortunately, we only need about 5, but they got to pass a drug screening before they can even start. But once they get started, I mean, you can kind of tell that the drug issue is the biggest one, because they quit functioning. They can't even hold a job.
So we certainly know that is countywide. We've heard that on NPR for Muncie a few times, unfortunately. So we'll keep working on that as well. We are coming to the end of our time, but I would like to ask one last question, and that we know that the tobacco tax is one thing that we're looking at, but also there's a 1-800-QUIT line available to people throughout the state. Can you talk a little bit about how you might be using that with your employees, or how you might like to use that with your employees?
All of our employees are aware of it, and they also push it out to our patients. So the providers, our medical assistants, all of our employees are well aware of it. And it's part of the arsenal to get people to quit. The easier we can make it, the better it's going to be.
I would agree. We like to think we have a toolkit available, and that's a huge part of our toolkit. So if employees come and they want to know how to quit, we have a health coach, we have the 1-800-QUIT line, and often it's a combo of those two things. The QUIT line allows them to call or get online and utilize those resources at their own time. The health coach can hold them accountable. It may be a health coach, it may be a coworker, it may be a family member. So trying to find accountability, whatever your personal accountability is a huge part of what we do. But the QUIT line is an excellent resource that has been very successful for several of our employees.
Same. I mean, I would just echo what both of them said.
So with that, I'd like to ask you to join me in thanking our panel.